9 p.m. edition of the Urban Debate, and here tonight we have a Mega Times Network exclusive for you. Viewers, for the past many weeks, we have been in association with Protiviti, collating data together and analyzing it to understand where we are going. I'll tell you why we've been doing this, and some of that data we'll present to you right now. Because everybody is wondering just how long are we going to be in this present situation? Aren't you wondering that? How long before you can actually step out? How long before you can actually travel? How long before you are actually able to get back to your office, restart your business, go to a restaurant and have a decent meal with your family? How long before you can go and meet your family members in another city or plan a vacation? These are the questions that are going on in all of our minds. But the fact of the matter is, we don't know where we are headed. We only have the data that we're getting from the government on the daily basis. So this is our attempt. It's a Times Fact Protiviti report that takes in multiple variables and different formats to try and project how many cases would we have from now to a week later, to a month later, to even 3 months later. What should we be prepared for? And viewers, these may not be accurate numbers because nobody can really predict at this point of time how this is going to exactly pan out. Cases can suddenly go up, suddenly go down. It depends on what the government's policy is tomorrow, the amount of clampdown, the amount of relaxation, whether people follow social distancing or not. So many variables to how things may pan out differently. But as things stand today, basis the data that has been available to us today and has been given to us from government authorities in the last many weeks, we are going to present you a picture of just what may happen in your city. So that's the one thing that we are going to be looking at. And we're going to focus on cities like Mumbai, Pune, Chennai, Delhi, Ahmedabad, Indore. I'll also tell you why we've picked these cities to begin with, even though we have numbers pan-India and state-wise. Before we reveal the numbers to you, let me first go across to our expert, Dhrubo Ghosh Dastidar. He is the Director for Data Analytics and Digital Transformation at Protiviti India. And this whole work, this research report, has actually been done in association with Protiviti. The numbers that we will put out to you will be dated 5th of May. So keep in mind that the last 2 days numbers haven't been included. But Dhrubo, just explain to our viewers how we've gone about, this math, this projection. What's the methodology?
Right. Thanks, Tanvi, for having me here. So we started, when Protiviti and Times Network started, we started looking at different countries and how they have been working. So we started looking at what is called a percentage-based method. So if Italy moved at 10% on day 3, if India did that, where we will be at the end of, let's say, 25 days or 35 days. Then we went up one step ahead and we started looking at what we call as time series. Time series actually looks the prediction of a day as a factor of the time, which means 30 days. So it will try to predict based on the number of days which has gone by. Now, the hybrid model that we started looking at Protiviti was a combination of how it behaved in China and how it behaved in South Korea. The reason we took a hybrid of these two is because of the population density, which is also there, as well as the way they have behaved over a period of time. And lastly, what we used is called a SIR model. It looks at the susceptible population, the exposed population, the infected population, and the number of people who are recovering. And why we use the SIR model? This kind of models are generally used for the purpose of predicting pandemics. It has been used during the Ebola time. It has also been used for H1N1 epidemics and pandemics, which has happened earlier as well. So SIR gives us a long-term projection. It tells us when we can expect a peak, when we can expect the end of the infection, whereas a hybrid time series model helps us predict the near future to a large degree of accuracy. the kind of predictions which we're getting roughly varies between 90 to 95% of what's happening actually. So that's why each of the combination of models, it gives us the band in which we can expect this kind of a pandemic to operate on.
Okay, Dhrubo, also give us an insight into how we should read this data. What we are going to put out for our viewers in just a few minutes from now is actually the most likely scenario, which, like you said, is an average of two different projections that you have done. And we will start from today to what may happen and is projected to happen up to August. There is a peak date and there is also an end date. If you can just explain to our viewers how this data should be read.
Okay, again, this is statistical, right? So we are looking at some kind of information or data which is available to us right now. So if I have to look at, I would look at the next 7 days, which it will predict more accurately. And then there will be a degree of variation as we move on. So the dates or the peak time and the end time, the SIR model predicts more or less on a very accurate basis. So if we look at the peak dates, we would rather concentrate on the peak dates and not on the exact number. There will be a little variation, and as we move ahead, it will be better for us to fine-tune these models. But right now, if I have to understand what is going to happen in the next 7 days or 10 days or 14 days, I would rather focus on that. There is another very important thing which makes sense to look at, which is called the R naught, or the rate of reproduction. The rate of reproduction tells you how fast this virus is spreading, or how many people can get infected from one person. The states or the cities which has an R naught of 1.5 or less are states and cities where we can expect normalcy to come earlier than the others. If we have an R naught of 1.6 or above, and in certain cases 2, those are cities and states we have to be a little mindful of, watchful of. We need to look at those states very differently. And if you look at India, India is a combination of states, right? Like in the different parts of the world, certain countries peak at different times. In India also, different states peak at different points of time. So we will have to look at India as states rather than India overall. The end date or the peak date of India is driven by certain states which peaks or ends at a later date. So we have to be also conscious of that fact.
Okay, all right, Dhrubo, thanks so much for really breaking it down and decoding this for our viewers before we bring out the data for them. One thing that Dhrubo was just telling us, viewers, is the R naught data, which effectively means how many people can get infected because of one person. And if that value is less than 1.5, then you're relatively in a better situation. And the cities and states that we have to watch out for are the ones that have a R naught value of more than 1.5. For example, 2, which means each person can still infect 2 more people, and that's a difficult situation to stare at. Now, the cities we're actually talking about today, the biggest of India's metros, are unfortunately all in that category and will need to be under the scanner with strict rules for some time if this data is to be looked at from that perspective. Without wasting any more time, let me get you the data that we have prepared for you. And we're going to start with Mumbai. We were just talking about Mumbai and how tough the situation is right now. Let's get you that graph on your screens right now. Because on May 7th, according to our projections, the most likely in terms of number of cases, active cases, would have been 8162. And we're literally there. In terms of active cases, that's where we are in the city of Mumbai right now. Now, as per our projections, this number of active cases, remember, not total cases active right now, not the ones who've recovered. By May 15, this number will go to 10,316. By July 1st, it is projected to hit 6,344. So actually, for Mumbai, we are going to peak around May 30th, June 1st, where the number of active cases are projected to go right up to 12,580 cases. And then we will see a bit of turnaround. That's when the number of active cases will begin to come down, which means that number of fresh cases will reduce, people will be recovering more and getting discharged, and hence the number of active cases will come down. But it's a long road. As per these projections, even till August 1st, we are likely to have about 500 cases. And I want to highlight, this is the most likely scenario based on two different kind of projections that Dhrubo was just explaining to you. Pune, right next to the city of Mumbai, is no better. May 7th, most likely 1344, which is literally what we are looking at right now. What will happen, say by May 15th, it is projected to go up to 1141 cases. And then again, it will begin to taper off. So by June 1st, we will have a lower number of active cases, around 955. July 1st, we are likely to have a much lower number of cases at 35. So Pune has been one of those cities that's seen a high number of cases. But the good news is by June, July, we will begin to see a significant reduction in those numbers. And the third city I will give you the numbers before we go to our panelists is the national capital, Delhi. As big a concern as some of the other cities. By May 15th, viewers, the projection for active cases is 5,433. But if you think that's going to be the worst, it's not. For Delhi also, the cases will continue to go up even after that. By June 1st, Delhi is projected to have 7,296, roughly 7,300 cases, and then the turnaround will take place, effectively bringing us to about 200 odd cases around 1st of August. So again, brace yourselves. You're in for at least a few weeks, in for the long haul, if the situation doesn't change from what it is today, which it might. And hence the projections will then change. Let's say good evening to our panelists who are also joining us. We want to understand that if this is the math we're looking at, this is the possibility, how should we prepare ourselves? That's the only idea. If these are the number of cases projected, how do we prepare ourselves? Let's say good evening to Dr. Raj Singh, pulmonologist with Apollo Hospital in Chennai, Dr. Sanjeev Bagai, chairman for Nephron Clinics, Dr. Mangesh Patel, chairman for IMA Hospital Board of India, in Maharashtra. He is also a member of the IMA National COVID Task Force, and Dr. Prabhakaran, cardiologist and epidemiologist, Vice President for Research and Policy with PHFI. Let me start with Dr. Mangesh first. Dr. Mangesh, the road to recovery for all of these cities seems to be long. Now, if we are going to see a continuous rise in cases this month as well, how do we prepare ourselves?
First is there are a two-pronged approach is there. It is very clear there is nothing new we are talking about this. The way we are in lockdown now, more than say 6 weeks now in the lockdown, how we implement this lockdown and how people abide by the guidelines which are given during this lockdown, that is most important. And secondly, during this lockdown, how we utilize this period for the healthcare preparedness, how much we succeed in that. These are the two things which are going to decide our fate, our future. Thank you.
Okay, let me also go across to Dr. Bagai. Dr. Bagai, we've had conversations about how the policy should be. For example, now in Mumbai, in the last 5 days, we've seen a sudden spurt in cases. And so the authorities have decided that the patients with mild symptoms who are asymptomatic should be sent home, because we need the space in our hospitals for the ones with serious symptoms and comorbidities. Now, if the numbers are projected to further go up in Mumbai, in Pune, in Delhi, how do the government and authorities prepare themselves?
Good evening. There are a couple of important points in sequential series of importance. I think what this necrotizing infection has actually displayed and ruthlessly exposed world over, not only in India, is the chronic underfunding of public health. That's taken a severe beating for the last 100-odd years worldwide. And that's why these kind of pandemics are coming up, and they're coming up more frequently. With regards to the graph and the projections, I think it's important that the graphs give us a rough framework as to what the parameters set are as a predictive value. But graphs, either exponential growth or a decline in the graph, are never intuitive, because you can never capture an untangible or a non-tangible factor like social behavior. So I think in the major metros, especially where the numbers are up, and they are continuing to rise for the present moment, I think it's very, very, very important, as what we say in terms of war, all hands on deck. So even in places like Bombay, they're pulling in private doctors from all nooks and corners to make sure that the facilities are running well. With regards what the next steps are, I think the numbers are there, and I will not be worried too much about the total number of cases, because once we include the ELISA test, which is the rapid test, which gives us the complete cohort of the disease spectrum, the numbers actually in reality may be a little bit more. But the only actionable matrix is the daily progression rate as a ratio to what we call as the death rate. So if we manage to keep the death rate down, the corrected case fatality down, I think we will be in a safe zone. With regards the next 15 days to 20 days, I think will determine how June will go, because the graph is dynamic and things can change. But it's important really at this stage to understand that if we twinkle toe in the realms of sinister, of fantasy, we may land up in the wrong end of the curve. It's very important and critical that we manage the cases now, keep identifying and keep testing and quarantining, and decongest the hot zones. So places like Dharavi in Bombay need to be urgently decongested, because they will continue to breed patients. So if we keep the infectivity rate low and the death rate low, we will be in a safer zone than otherwise.
Yes, no, I completely agree with you, and it's one wrong step from here and we could be in bigger trouble, which is why it's essential to see what are the likely scenarios, only so that we can prepare ourselves, only so that the governments know, the civic bodies know, the hospitals know just what we should be bracing ourselves for. I just want to, before I go to our other two panelists, bring out the other three cities as well and give you those numbers. And viewers, let's talk about Chennai, and I want to talk about Chennai because that's one city that initially didn't have too many cases, didn't have any cases to begin with, and then just very few. And in the last 10 days, the situation is completely changed. Chennai now has 4% of the cases in India, just as high as Pune, which has been registering cases right from the beginning. Bombay has 20% of India's cases, and Delhi has roughly about 10%. That's why these cities are in focus right now. Chennai, by May 15th, is projected to have roughly 2,500 cases. By June 1st, it is projected to have about 2,328 cases. So it will begin to come down after May 15th, around June 1st actually. And by July 1st, it is most likely to have about 800 cases. So the reduction will be slow and gradual. And the projections show that hopefully by August 1st, Chennai would have roughly less than 100 cases, about 75 cases, if we are able to actually tackle it properly and as per the norms that we have right now. I want to highlight Indore, because Indore is one of the cities in Madhya Pradesh, along with Bhopal, that has seen extreme tight, strict restrictions from day one. There have been other reports about the kind of strain that has been detected there, and things have been tough for the city of Indore. The city of Indore is likely to begin to see some relief this month itself. So by May 15th, the number of active cases will actually come down to about 876. By June 1st, the number of active cases are likely to then further half to about 420. And by August 1st, the number of active cases will be far lower to about 36. But keep in mind, Indore is also a smaller city, so even then 36 is not something that we should take lightly. And Ahmedabad is the last city I want to talk about. Because again, like Chennai and Ahmedabad, in the last couple of weeks, we've seen a significant increase that took place because of few people who were in the essential services who were then detected, and because they had moved around and traveled and interacted with many more people, suddenly there was a spurt in cases. Ahmedabad is most likely to see an increase in cases up to May 15th, where it could go right up to 3,958 cases and then further up. So Ahmedabad's curve is moving slowly still further up, and it could go up till 4,300 cases by June 1st. After that, you will begin to see some relief coming in, and the number of active cases then reducing to about 3,400 by 1st of July and then 583 by 1st of August. So actually for Ahmedabad, the road to recovery is going to be longer than some of the other cities. And I want to just highlight once again, viewers, that this is keeping in mind data we had up till 5th of May. That's 2 days ago. For some of the cities, the data has significantly changed in the last couple of days. In Mumbai, we've had like 1,000 cases every day, which would change these projections a little bit. But going back to our panelists and our experts who are with us, Dr. Singh, how does one prepare for a situation like this, where even we're now talking about a situation that even till the month of July and August, most of these cities will have quite a few active cases?
Yes, thank you, Tanvi. I think, first of all, I think we should all be reminded that this is a very new infection of which we do not know anything very definitely. We have obviously learned quite a bit over the last 6 months, and I think we know a little bit more about it, but certainly we cannot predict how it is going to play out in different scenarios, in different environments. And I think when you look at the way it is behaved elsewhere in the world, you can see that there is no real consistency. I think in different parts of the world, it has progressed very rapidly and killed a lot of people, whereas in other parts, it has become much milder. So how exactly it's going to play out in India, and also comparing, say, Mumbai with Chennai or any other city for that matter, there are too many factors here which can interplay and influence the way the disease is going to behave. Having said that, I think we started out very well, having employed the lockdown at an early phase and have been very effective in postponing the surge in cases. Now, I emphasize the word postponing because we didn't set out to eradicate the infection. And even though in some states it brought down remarkably, as in Kerala, it was not the strategy that was envisaged. It was to postpone it, to buy us some time in order to prepare ourselves for the onslaught of fresh new cases. And I think once the lockdown is released, that increase in the number of cases can be expected. Exactly where it will peak and how it will play out after that remains to be seen. So I think the right strategy now will be to release the lockdown guardedly, so that we can see exactly how many cases do increase. And when we do find increasing numbers, there's really no need to panic, because that's exactly part of the strategy that we have mapped out. And when there is an increase, it will reach a certain point when it will start going down automatically. And that will happen with or without the lockdown. And that is really the peak, at which time we can expect it to come down and eventually fade out. And it has happened in the past with various other pandemics.
Okay, all right. I take what you're saying. Let me also bring in Dr. Prabhakaran. Dr. Prabhakaran, the intention is to use this data to help us formulate better policies. Now, we can see that cities that have crowded clusters, and slum areas are obviously struggling. Mumbai seems to be struggling for that reason. We've attempted many things within the slum areas and then realized that door-to-door screening or thermal screening is not going to help. Temporary clinics within that area wasn't helping. So now we need to bring some of those people out. How do we deal with this on a longer term basis? It's all right to say people can be in lockdown for a month or 1.5 months, but at some point that movement will also begin.
Hello? Hello, can you hear me?
Yes, Dr. Prabhakaran, can you hear me?
Yeah,
yes,
I can hear you. Okay, thank you. To answer your question with regard to what do we do now, I mean, we cannot, perpetually have this lockdown just to get people not to get infected. So what should be done? I think we are reaching the law of diminishing returns in terms of the lockdown because, I think the economy is going to flounder if we continue with the lockdown at this level. So I think there are a few things that can be done. One, I think the lockdown has to be decentralized, as I had pointed out earlier in your debate too, that in each of the places where there are very high cases, even within a district, we need to have a decentralized look. Second thing is, I just want to say these three things are extremely important. One is use of masks. Let's look at three scenarios where a person is infected, not wearing a mask, a person who is uninfected and he's also not wearing a mask. The chances of spread is almost 70-75%, the other person acquiring. Second scenario where the person who is infected is wearing a mask, the person who is not infected is wearing a mask. Even here, the chances of getting infected is around 30-35%. When both people are wearing masks, it comes down to as low as 3%. So I'm emphasizing this point that the new normal has to be the masks. Second, of course, we should continue with social distancing, but I would call it slightly different. We should protect our vulnerable population, that is the elderly, people with comorbid conditions. So allow people to work who are younger, but we need to isolate these people, which is going to be an extremely difficult job given that people are living in one room and two-room tenements where they are likely to get infected. But at least where possible, their safe distance could be maintained, and people who are going out and working should self-isolate them when they come home or do something else. Then the third thing is work from home wherever possible. I mean, this is at least possible in terms of the IT industry and others. That should be followed. Then the next thing is protecting the high-risk population, that is the doctors, healthcare workers of any hue. I mean, nurses, sweepers, whoever it is, we need to protect them. Then in terms of starting work, some states are doing this, that they're having two shifts so that you don't have everybody in the office at the same time. People are coming at different times, so you divide the office into two groups and people can work at different points in time. The costs, of course, will go up, but I think it is much better than not, starting off working. And most important is, I think there is some good news because there are at least 10 to 12 different drugs that are being tried across the world, and I think we may be able to get something by September or so. So if we manage the situation till September, we may have something to look for. And finally, obviously, everybody is looking at herd immunity and vaccine, but I think that is 9 to 12 months away in the best case scenario, and that would be the best thing to happen if we're able to vaccinate our population and get the herd immunity going. And of course, we also require structural modifications in healthcare. As somebody yesterday or day before yesterday pointed out that we should send all these patients to a stadium. But the question is, how do we send patients to a stadium? Where is the oxygen? Where is the piped oxygen connection or even a cylinder? So you need to prepare that, at least in cases where we are going to get overwhelmed by these cases and where the healthcare systems are going to get overwhelmed. So I think if we prepare ourselves for this, the next 3-4 months, we would have managed to control this problem. Thank you.
Okay, let me actually take some of the points that you said and take them forward. Dr. Sanjeev Bagai, this should also help us, prepare ourselves, isn't it? That for now, several weeks, a lot of us in these cities will have to work from home. We'll have to get used to being within our own homes. Even if we say that the lockdown is relaxed, not everybody can get on a public transport, bus or a train and get to work. We will have to get used to wearing masks, perhaps not going to restaurants for a really long time. So that change in mindset will need to be done, considering that the data itself shows that these cases could continue till August, September.
That is, Tanvi, very, very true. It's important for everyone to know and understand and perceive that this COVID virus is here to stay for many months, maybe even for a couple of years. What generally happens is that the virulence of the virus gradually decreases over a period of weeks to months. The second is our government preparedness is so much better now because we know what we are at least partly dealing with. Our medical preparedness is a lot better in terms of infrastructure, in terms of protocols, in terms of SOPs, in terms of ventilators, ICU beds, COVID hospitals, and so on. Very important is that point number 3 is that the social awareness now is on many fronts. I think the lockdown has really served in this purposes. It's given a message to a common person. Even a fruit vendor on the streets is wearing a mask, hand hygiene, keeping a distance of 3 to 6 feet, and so on, and not overcrowding. So I think that's going to be the new norm. With regards going forward, I think people will have to learn and understand and readjust to what the new realm is. The new realm is going to be a restructuring of the work culture, a restructuring of our travel, restructuring of how we meet, entertain, socialize, and very importantly in medicine is increasing increasing expenditure and investment in public health. I keep saying this, and I'll keep saying it for the next many years. I think that's the most important fundamental thing. In the end point of this is what? We are dealing with a population of 1.35 billion. That means we are adding 28 million newborns every year in India. That is, we are increasing our population size by one Australia added on to India every year. Unless and until we don't revisit and give a complete reinvent look towards birth control in terms of population control, no country will have that much infrastructure, money, and facilities to look after this kind of bursting population. So I think it's a multi-pronged attack. I think the government has done a very, very good job. I know they're getting a flack on many fronts, but it's not easy to quarantine the largest given population outside China in one place at one time.
No, you are absolutely right. And I think, even for many in the government, this is an unprecedented situation. It's not as if we have a plan ready to say, okay, if such a pandemic strikes, this is what you do, this is how you deal with it for a country with the kind of population that we have. And so there will be many learnings as long as we react to these learnings and we implement those learnings quickly, one should be able to deal with this better. Dr. Raj, what's your own sense, at least for these cities? I just want to also highlight this data to our viewers as I go to Dr. Raj. We also consolidated what could be the projected peak date, which is when you have the highest number of active cases, and after that they start reducing because the number of fresh cases start reducing. And we also did a projection on what could be the projected end date. Now, if you look at Mumbai, the projected peak date is likely to be 30th of May. That's when we are going to be peaking. And a projected end date, which is when you have a very small number of cases left, is actually in the month of July, by about 5th July. And after that also it will continue as per one model. The other model says by 18th of August. So clearly we are in the long haul. Similarly, if you see for Chennai, Ahmedabad, the peak end dates are roughly somewhere in July and August, which means that we have to prepare ourselves, Dr. Raj, that the infection isn't going anywhere, and we need to redesign our lives around it, beyond the lockdown.
Yes. So I think what is clear is that what happens later on, from now onward, really depends on two main things. One is when this lockdown is going to be lifted, and after that, how our behavior pattern will be. Now, for the peak date to appear, a certain percentage of the population would have to be infected. And that will depend on how stringent the lockdown is. And if some states have been following this very effectively, it means that most of the population would not have been actually exposed to the infection. And therefore, they are naive. And when the lockdown is lifted, you can expect a surge in cases. But in states like Maharashtra, which has already been exposed to a large number of cases, then you can expect the peak sooner, and it will subside also sooner. But after the lockdown, I think our cultural patterns would have to change. Even after the lockdown, some permanent changes in behavior would have to be in place. And I think Dr. Bagai quite rightly pointed out the cultural changes which we need to make in order to prevent this infection, as well as many other infections which we incidentally have, from spreading and affecting all of us. And as Dr. Prabhakaran also mentioned, that there are a number of factors which we can inculcate in order to prevent not only this infection, but various other infections which are killing thousands of people every day.
Okay, I am completely out of time, but it was a pleasure to have all you experts joining us right now. We didn't want to do a political debate about it. We wanted, experts giving us their insights on, how to prepare ourselves better individually, and of course even for the governments, if this is the projections, if this is the way we are headed. And viewers, I want to tell you this, while the data that we used for these projections was up till May 5th, keeping in mind the different scenarios and different variables, the data has changed for some of the cities in the past 2 days. But we have been doing this research along with Protiviti for over a month now. And week after week, the data that we've projected has pretty much been on the same lines as the actual active cases that have come out. And so this is the way it seems we may be headed, unless there is a drastic change in policy that, of course, none of us can really foresee at this point of time. Suffice to say that the authorities, the corporations and the governments, ministers in these cities cannot take their eyes off the ball. It's going to be a tough challenge. We need to continue with our building of healthcare infrastructure. We need to ensure that our frontline warriors, the policemen, the healthcare work professionals are safe, that there are enough of them, that they don't burn out and tire out, that we support them in every possible way. We need to ensure that our policies are designed in such a way that focus is actually given to the serious cases, that healthcare facilities are provided to them, while the others self-discipline and follow the restrictions that have been put in place. That's the only way. You and I together that's the only way to fight this infection at this point of time from it getting bigger. The good news is our mortality rate is not that high. The good news also is that our recovery rate is improving. Yet, by sheer size of our population, we should be prepared that the number of cases are going to be high for some time now. Thank you so much for joining us on this conversation.